we've experienced a 500% increase in requests for mental health counselling.
The organization behind me says they've seen an unprecedented demand for youth mental health services from January 2020 to March of this year. And now a 5-year action plan is being put in place to improve Manitoba's mental health and addiction services. Nancy Heinrichs, executive director with Norwest Community Co-op, says the pandemic has dramatically increased the number of young people experiencing mental health issues like depression and anxiety.
I've worked in mental health almost all of my career, about 30 years now. And during this time, I have never seen a time where mental health is more important than now.
Heinrichs anticipates the demand for mental health and addiction services will continue to grow in the coming months and years as Manitoba makes its way through the pandemic. Norwest Youth Hub has received funding to increase counseling and psychologist appointments by about 150 youth per year as part of the province's preliminary 5-year action plan to improve Manitoba's mental health and addiction services.
The 5-year action plan will help shape the strategic priorities of my department and set the directions for years to come.
Audrey Gordon, Minister of Mental Health, Wellness and Recovery, says the new plan will focus on evidence-based, data-driven services, service access and coordination, substance use and recovery, population health and wellness, and accountability for services. Gordon says the Virgo Report, Peachy Report, and report from the Illicit Drug Task Force will be combined with public consultation to fully develop the new plan, which will be released before the end of this year.
This will help us ensure that our priorities are your priorities and that we all work together to strengthen the service delivery system in Manitoba.
But not everyone is on board with today's announcement. Bernadette Smith from the NDP writes, "Today's announcement is another blow to families who are struggling or have lost loved ones to addiction and mental illness. The PCs need to be transparent and release reports on overdose deaths so we know what resources we need to help families. It's clear that harm reduction strategies like safe consumption sites save lives, but the PCs removed safe consumption sites from their own Virgo report. Their outdated approach and refusal to act is hurting Manitoba families." As for Heinrichs, she says people who have never dealt with depression or anxiety before the pandemic are now experiencing it for the first time.
I think we're going to see for a long time to come a lot of anxiety and depression in our youth, but I would guess in our adults as well.
In Winnipeg, Mark Neufeld, City News.